outbreaks. Have ever involved in the outbreak investigation or outbreak management? 特にないですか? Okay, so it's a nice chance to expose yourself as a public health practice focusing on outbreak investigation. So outbreak management have a two ways. First, it's some pick up unusual issues, pick up strange issues. For example, increase of the cases or increase of the isolate of some specific pathogens or something like that. So this part, number one, confirmation of unusuals, pick up unusuals, is also big topics. But today I do not move into this part. But today I'll move on with this field investigation, outbreak investigation. So as I mentioned, we have two ways. Once we pick up unusuals, outbreaks, let's say, so we have two ways. The first one is control measures in a meantime. And the second way is investigation. So here, this might be useful, this chart. Because this chart and the knowledge of common sense and knowledge of the textbooks, you have some idea about how to control this communicable disease among human population in the meantime. However, control in the meantime is just in the meantime. After field investigation, we have some idea about some direct source of the outbreaks. Let's focus on the outbreaks and transmission route. How to transmit pathogens, how to transmit some dirty water or something like that, and risk factors for this outbreak or these diseases. What kind of factors are influencing the outbreaks? And after we identify these source, root factors, etc., then we can move on to the real, some sort of real control measures, evidence-based control measures. So here, some sort of isolation. So last week, so you asked me, excuse me, so the doctor, right? You asked me, so this chart, it's a self-explanatory, but this chart is useful for this part. In the meantime, after we have outbreak investigation, so we have some concrete idea about what is the wrong one, what is some transmission route, what is the risk factors. Then based on these evidence, these knowledges, we can move on to the real, not real, it's a practical, timely, realistic control measures. And then after that, we have a recommendation in order to prevent the future same-time outbreaks. So that is some sort of key component or bone component of outbreak management or any other public health programs. But today, we are focusing on the outbreaks. It makes sense. It's also simple and self-explanatory. 日本語で特に分かりやすい、特に変わったことは言ってませんよね。当座の対応と原因究明と2本立て。Now back to the English. So, does anybody who used to work in the hospitals as a doctor or nurse, did you have a experience of outbreaks? Some, for example, MRSA or drug resistance issue or influenza, はしか、measles とか、特にないですか? From the doctors or nurses working in the hospital in Japan. 特にぶち当たらなかったですか? なんかあり? So you used to have influenza outbreaks in the winter time, in the epidemic period. So at that time, what did you do? どんなことをしました If you identify influenza cases in your ward, let's say, so what did you do?
インフルエンザの患者さんをまず出たら同じ部屋にいた
I
人
see.
をコホーティングしたりとか、ずっと追跡調査して、3日間とか熱が出ないかとかっていうところにいたりしながら
I see. He said he identified the cases of influenza and isolating the influenza cases and separate influenza cases and health cases and follow up health situation of the health patient of the same ward for several days in order to identify it became a sick or not. So that's some sort of control measures in a meantime, and also it's a. But did you have some investigation or influenza in the hospital? It's some sort of simple because your universe is in your ward. 自分のウォードだ病棟だけが宇宙ですもんね。悪い意味じゃなくて。Yeah. Their universe is their ward or a hospital. But as a public health practitioners or field epidemiologists, our universe, our responsible universe is some communities or healthy group, healthy population. So we need this outbreak investigation, field investigation using epidemiology or statistics in order to identify the real cause and source, root factor, risk factors, and in the future to prevent some same-time outbreaks. So, field investigation, we actually maybe it's no use for the outbreak definition. Have you ever heard the definition of outbreak? But it's just for your curiosities. Sometimes outbreak is basically occurrence more cases than you expected. In order to identify outbreaks or in order to identify unusuals, you have to know the normal baseline level. 異常を知るためには普通の状態知らなくちゃダメですよね。So, in order to know the baseline level or usual level, it's also a very important issue for the public health practitioner, field epidemiologist. Have you ever heard of public health surveillance? サーベランスって聞いたことありますか？Yeah, surveillance is a very important weapon for public health practitioners or epidemiologists. We do not go into in detail. However, specifically on the communicable disease in Japan, we have a national surveillance system, and every week, every month, when the doctor pick up the measles cases, let's say measles or influenza cases, they have to report to the public health office in the local area. And every week, such information is gathered and aggregated in the central level of National Institute of Infectious Disease. And our field epidemiologists or public health practitioners summarized and analyze the data. And then we can pick up, for example, in Kyoto area, this week we have a huge number of measles cases, or let's say some unusual death was occurred in the northern part of Tohoku area or whatever. そういうふうなサーベイランスはあるんですけども、ちょっと今日はそこまではいきませんね。So, what I want to say today is surveillance is a strong weapon. But, 違う。But today we are focusing on this part, not for the surveillance issues.